Welcome to Capital Catch-Up, your deep dive into the halls of Congress. I am Victor.
And I am Leanie. Today, we are unpacking a wide array of recently introduced bills, some key safety and healthcare measures, and the latest administrative proceedings from the House of Representatives.
Let us start with what actually happened on the House floor on August 17, 2026. According to the Congressional Record, Volume 172, Number 133, the session was primarily administrative and ceremonial. Representative Craig A. Goldman was designated as Speaker pro tempore.
For our listeners who might not know, a Speaker pro tempore is a member designated to temporarily preside over the chamber in the absence of the Speaker. The session began with a prayer from Reverend Stephanie Vader, focusing on healing, creation, and the moral responsibility of leadership.
After approving the previous day's journal and reciting the Pledge of Allegiance, the House adjourned until August 20, 2026. But the record also included detailed expenditure reports for official foreign travel by members and staff between April and June of 2026, documenting costs associated with diplomatic visits to Europe, Africa, and South America.
It is a reminder of the global reach of congressional oversight. Speaking of August 17, 2026, there was a specific resolution introduced to mark that date in the future. House Resolution 1484 formally recognizes the vital role of the nonprofit sector in the United States and supports designating August 17, 2026 as National Nonprofit Day.
Nonprofits are a massive part of our economy, employing over 12 million people. This resolution highlights them as essential, cost-effective partners to the government in providing public services and community support.
Now, let us shift to some major legislative proposals that could directly impact everyday Americans, starting with healthcare. House Bill 4581, known as the 340B Patients Act of 2025, aims to strengthen the 340B drug discount program.
This is a big deal for community health centers and hospitals. The bill clarifies that drug manufacturers must provide discounted pricing to covered entities regardless of how or where a drug is dispensed. This includes contract pharmacy arrangements, which have been a major point of discussion.
Exactly. It explicitly prohibits manufacturers from imposing restrictive conditions, like limiting delivery methods or demanding excessive data submissions. And it puts teeth into these rules with civil monetary penalties of up to $2 million per day for intentional violations, alongside a formal reporting process for covered entities.
That is a massive penalty, showing just how serious lawmakers are about protecting the financial integrity of this program, so healthcare providers can stretch their resources to care for communities.
Another critical healthcare and safety measure is House Bill 9127, the Sergeant Dave Crete Forgotten Veterans Act of 2026. This bill addresses military personnel exposed to toxic substances at specific high-risk locations, like the Nevada Test and Training Range and the Nevada National Security Site.
It directs the Department of Veterans Affairs and the Department of Defense to coordinate and identify these veterans, create a formal registry, and establish a presumption of toxic exposure.
A presumption of toxic exposure is a major procedural shift. Normally, veterans have to provide affirmative evidence that their illness was caused by their service. Under a presumption, the government automatically accepts that the exposure occurred at these sites, making it much easier for veterans to secure benefits. It also mandates a scientific study and directs the Defense Department to officially classify these locations as contaminated sites.
Moving from veterans, health to infrastructure, let us look at House Bill 7784, the Secure Tracks Act. This bill focuses on railway safety by establishing rigorous federal standards for inspecting and maintaining mainline tracks.
It mandates minimum frequencies for visual inspections by qualified personnel and requires the use of a track geometry measurement system, or TGMS. The inspection intervals are scaled based on traffic volume and speed. It also requires immediate remediation of safety defects and prevents the Secretary of Transportation from granting waivers that would compromise safety coverage.
This is clearly aimed at preventing train accidents and ensuring operational integrity. Now, on the immigration front, we have two very different bills. First, House Bill 8586, the Americans First Immigration Act.
This bill proposes major changes to the Immigration and Nationality Act. It prioritizes domestic labor by requiring employers hiring foreign workers to prove they actively recruited U.S. workers, offered competitive wages, and did not lay off domestic employees in similar roles.
It sets up an enforcement framework with Department of Labor investigations and binding arbitration, with fines and visa disqualification for non-compliant employers. It also requires prospective immigrants to commit to U.S. constitutional principles, renounce practices like religious-based persecution, honor killings, and female genital mutilation. And it would eliminate the diversity visa lottery to cap religious worker visas at 3,000.
The other immigration bill is House Bill 4651, the Immigration Enforcement Staff Body Camera Accountability Act. This would require all Immigration and Customs Enforcement and Customs and Border Protection personnel, as well as immigration detention staff, to wear active body cameras during their entire shifts.
The Secretary of Homeland Security would establish policies for camera use, facial recognition integration, and footage access for legal proceedings, aligning with civil rights standards. Officers who failed to record could face pay reductions or suspensions, and the Inspector General would conduct annual privacy impact assessments. Notably, the bill does not authorize any additional federal funding.
Let us quickly go through some of the other interesting bills introduced recently. House Bill 10,110 addresses the housing rental market by requiring the disclosure of algorithmic price fixing, which could have a huge impact on renters across the country.
Yes, algorithmic pricing has been a major topic lately. Then we have House Bill 10,109, which amends the Commodity Exchange Act to prohibit wildfire event contracts on prediction markets. Prediction markets allow people to bet on the outcomes of events, and this bill would block bets on wildfires.
There is also House Bill 10,115, which amends the Radiation Exposure Compensation Act to provide for claims related to atmospheric testing.
For first responders, House Bill 10,116 would establish an EMS and first responder wellness grant program.
And for education, House Bill 10,113 proposes revisions to the Individuals with Disabilities Education Act.
We also see House Bill 10,112, which amends the Investor Protection and Securities Reform Act of 2010 to provide state grants for the enhanced protection of senior investors and senior policyholders.
In terms of congressional oversight, House Bill 10,111 would prohibit the Secretary of Homeland Security from preventing members of Congress or accompanying staff from entering Department of Homeland Security facilities, housing or detaining aliens for oversight purposes.
There is also House Bill 10,117, requiring the Comptroller General to carry out a study regarding certain reptiles.
And finally, House Bill 10,114 proposes to designate the United States Postal Service facility at 15,642 Sand Canyon Avenue in Irvine, California, as the Mary Kageyama Nomura Post Office Building.
That is a lot of legislative activity. As we wrap up, what should our listeners keep an eye on?
Watch out for how the House moves forward with these safety and healthcare bills, particularly the Secure Tracks Act and the 340B Patients Act, as well as the implementation of the new body camera requirements if House Bill 4651 gains traction.
And we will see if the House schedules votes on these measures when they reconvene after August 20th. That is all for today's Capital Catch-Up.
Thanks for listening. We will see you next time.